For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October. Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at locations statewide. There are no polling places, so be sure to drop off your ballot at a place of deposit.
Hawaii votes by mail.
Well, happy Aloha Friday. It is October 30th. This is Spotlight Hawaii. I'm Ryan Kalesuji, joined by Yanji Denise. We see that reminder there. Yanji, only 3 days away to the election. Hard to believe we've gotten to this point. But again, the Office of Election, which sponsors this conversation here on Spotlight Hawaii, reminds you that if you do still have your ballot, to make sure that you drop it off at one of the election centers. You can also drop it off, of course, in person during the in-person voting that is going to be happening. But again, do not put it in the mail. That time has passed. But yeah, Yanji, 3 days away till the election.
Yeah, we are looking forward to talking about all the results. Of course, we are looking at having 5 new city council members. We're going to have a new prosecutor, a new mayor. There's obviously Hawaii County is obviously going to have a new mayor as well, and then a bunch of different state house races. So there's so much to talk about on that front. But today, as always, we have another special guest, and this is someone that we've really wanted to talk to for some time. We're speaking today with Hawaii Emergency Management Agency's director. That, of course, is Major General Ken Hara. He is also the incident commander for Hawaii's coronavirus response. He's been leading the charge here and helping to combat the virus in our community, and we want to talk to him about how that response is going. Thank you so much for being here today, sir. Just sort of broad base, how are things looking for us when it comes to responding to the coronavirus?
Well, right now it looks really, really good, right? We had some concerns starting in August as we saw the second spike, but just on the 20th of October, when I looked at the statistics, looking back as far, so between March 7 and October 28, Hawaii had the 5th lowest rate for both COVID-19 confirmed cases, and then also for the state's death rates, so per population of 100,000. So we've been doing really well. But, and that was a result of the policies and the orders and the supplemental proclamations that both the state and the counties had put forward. But unfortunately, counter to that, Hawaii went from having one of the best unemployment rates to the worst in the nation. So that is concerning.
Of course, something that you've been involved in specifically has been the safe travels, the reopening of Hawaii to trans-Pacific travel, and this pre-testing implementation that has really gone underway over the past few weeks now. Can you sort of give us an update on how things have been going on that front and the things that you have seen, maybe some of the numbers, and what you guys are learning through this process?
Sure. So let me start with saying, I mentioned about how the orders had affected our economy. So what we're trying to do is find the balance between what I've been calling the sweet spot. So how do we restore Hawaii's economy while still protecting the public's health? And that was kind of the main purpose of this Safe Travels Hawaii program, right? And trying to find that sweet spot. And when we moved forward with that plan, it was really a collaboration between the public and private sector. And I think that's why we're so successful with the October 15 launch. The program included the 72-hour pre-test for trusted partners. And the whole purpose for that was to prevent the infected travelers from traveling into the state. It wouldn't make sense for them, we test them here and then find out they're sick and then we got to put them in quarantine. So it was trying to prevent them from coming here. The health screening, we have the questions. They'll do additional screening at the airport if they are identified, if having any information that's of concern, and we offer a post-test at the airport. The mandatory travel quarantine for non-exempt travelers, which again protects our public, and then the phased reopening of the economy. Right, what the counties have been doing is a measured reopening to ensure we don't have a uncontrolled spread again. To get there, though, we looked at, okay, how do we set all of the lines of effort and everything that we do that supports this Safe Travels Hawaii? So let me talk a little bit of the accomplishments. When we received the CARES funding, we used that money. We purchased over $60 million worth of personal protective equipment and industrial hygiene. And that went not only to the state departments, but we also provide funding for, the hospitals, healthcare, and a lot of the at-risk, like the long-term care homes, Department of Education at University of Hawaii. So that had set the stage to try to prevent, right, the disease from spreading. Also, we increased our isolation and quarantine rooms. When we first looked at this Department of Health had only about 40 rooms available for isolation and quarantine. And now we have well over 400 for that, in case there is another surge. I need to point out that when we had about 300 rooms, and we had the second spike, we only went up to 84% occupancy. So that's really good news for Department of Health leaning forward and getting more rooms. Also, since then, Department of Health has published a statewide testing strategy that has helped us not only with the safe travels, but overall trying to prevent and identify cases throughout the state. And then the Department of Health contracted over 130 healthcare workers to help decompress the hospital surge. Early on during this pandemic, we thought we may need additional care facilities. But as we looked across the nation, and then as we looked internally within the state, it really wasn't the bed space that was a problem. It was the staffing and trying to help decompress the staff that are working, endless hours during the crisis. So that was critical for the Department of Health to get that additional staffing. We also increased within the state. I think when we start this, we had the capacity of about 2,000 tests per day. That is currently about 6,000, and then we spent several $1 million, and I believe soon will be about actually over 15,000 tests per day. So that will also help with the Department of Health's testing strategy. One thing you heard a lot in the media was the concern with the disease investigation and contact tracing. A lot of people complaining, hey, I tested positive, I've never been contacted. When we kind of looked over and then we first started with the National Guard, right, trying to surge that and assist the Department of Health. They had just under, I think, 20 individuals that were actively doing disease investigation and contact tracing. Now we have over 350. When we did our visit 2 days ago to the convention center, Dr. Robertson, who led that effort and did a tremendous job, she said they now have the capacity to do, in a surge, over 1,200 cases per day. Obviously, we'll never get to that, right? We'd have to scale back something to prevent that. But that tells us we no longer have any issue with disease investigation and contact tracing. One last thing. So the National Guard, we also created mobile swab teams that goes out to, if we have a cluster, and go to that location and be able to test those index cases and then the close contacts as part of the identifying people that need to be isolated. So a lot of great work. And all of this was related to the safe travels.
Let me ask you, I wanted to just get some clarification on that testing capacity number, because I was under the impression that we were looking at probably 5,000 tests per day could be handled. When do you think that we can get to that 15,000 number that you just laid out?
I think I had a text from Clinical Laboratories Hawaii, and they're saying their new system, the Panther system that does the testing, rapid test, in the next 2 weeks, it should be operational. And then I know diagnostic laboratory systems also, we use CARES funding to purchase equipment for them, but I didn't reach out to them yet to find out when they'll be operational. And then there are additional instruments that will be coming into the state.
Just going back to the safe travel and just the process in which, we are receiving guests and those who are entering Hawaii. What have you heard anything specifically about some of the issues that are happening? Because, we do hear some travelers who are having issues in getting that negative test really validated by the state. Maybe it might have been the wrong test, or there's some conflicts there, and they're actually now in quarantine here waiting for those kind of results. What are some of those things that are happening, and how are you guys sort of adjusting maybe some of these other problems as they've kind of come about through this testing program?
Yeah. So Ryan, before I get into that, I wanted to just mention that after we had the plan published and when you were ready to execute, everyone was on pins and needles. So the core team was meeting every single morning at 8 o'clock to the ramp up. And we still meet every day at 8 in the morning, including weekends, to ensure we're getting after that punch list that we talked about the issue. So the first one we had was long lines. That was a complaint. So we worked with some of the airlines to see if we could stagger the flights. And then the Department of Transportation airports increased staffing. Another big issue we had is as people were uploading their test results into that Google digital platform, they're using wrong format. They're taking pictures of pictures. The artificial intelligence as part of that digital platform really had a hard time identifying those critical data points that would clear them as being negative for COVID-19. So a lot of work by the enterprise technology system led by Doug Murdoch. And so a few things we did for that is one is we ensured that the system would only allow PDFs now to be uploaded. So that way we don't have the issue with pictures of pictures. A lot of messaging with airlines, with tourism companies, and then on all of our websites. And also what we did is work with the trusted partners to see if they could refine their result sheet so that it made it easier for the digital platform to read. So during that first portion, I'd say about the first week or so, there were a lot of people that received their negative results, but were not cleared by the AI system. And we had to put a lot of manpower in support of the Department of Health and ETS to be able to help clear that. And I believe we're caught up now. So as people come in, if the AI or artificial intelligence cannot read the form, someone can get to them within that 24 hours to get them out of quarantine.
On the subject of travel, there's some confusion for folks who want to go to the neighbor islands, not necessarily visitors from the mainland, but folks who are, domestic travel, if you will, inter-island travel, the Kama'aina economy. Do you foresee a time where we won't necessarily have to have the quarantine, the inter-island quarantine, and absent that, if we do have more testing capability, will it be a situation where we all just get tested before we board a plane, no matter where we're going?
So the bottom line answer to both of that is yes. And again, but it's conditions based. And the decision to institute the quarantine for inter-island and inter-county travel was a decision made by the mayors and the governor. So when they feel comfortable, they'll make that policy determination to lift any quarantine requirements for inter-island travel. So that's to answer your first question. To the second question, we're looking at increasing the amount of trusted partners for the inter-county travel, but then also looking at how can we use the less expensive test, the antigen test, so that people don't have to pay $130 to get on what sometimes is just a $40 ticket just to stay out of quarantine. So we are looking at that as future endeavors.
Yeah, because I think of the inter-island travel for a lot of us who are from the neighbor island and we want to go home for the weekend, and we're having to take a test for 72 hours, and we're not even there maybe for 72 hours. You're there for a few days, right. So it's the timing begs to be some of the biggest questions behind that, and how we sort of navigate through that, especially if it's for weekend travel. How do you think that the state can kind of work around that to sort of create a cleaner and easier process for those who are trying to travel between the islands?
Yeah, so we're working with the counties. So for the inter-county travel, the counties are the lead. And that was primarily because in a discussion with the mayors and the county EMs, that they were pushing for the quarantine, the travel quarantine. And at the time, we're all focused on the trans-Pacific travel. And we told them, we don't have the capacity to be able to come up with the different policies and the testing and the execution of the testing. So the counties all agreed that they'll take lead on that, and that's where we are right now. But as we move forward, and if we can get to antigen testing and rapid, I foresee if we do continue pre-testing, maybe we can do it right at the airport, just a saliva swab, and within 15 minutes, if you're positive or negative.
We always like to bring in questions from the audience. Jana has a question. She asks, but is the antigen test as accurate? Doesn't that tell you if you've already had COVID? Is that a reliable test?
So all the different ones. So a lot of the antigen test now has the specificity and sensitivity similar to PCR tests. So what the intent is if the antigen test is positive, because you have more false positives than negatives, which is really good, right? So if you test positive, we'll follow up with a PCR test for confirmation.
The other question that a lot of people have been talking about has just been the overall mask order and what is allowed and what is the order for certain counties as they vary. There have been calls for a statewide mask mandate. Is that something that you're involved in that conversation? And can you provide any updates on how something like that might in fact be implemented and how that would go about?
So I got to start this by saying I'm not a lawyer or attorney. And in discussion with Claire Connor, who's the Attorney General for the state of Hawaii, in her mind, there is a statewide face covering, right? It's non-medical face covering. And then it caveats, the supplemental caveats that the counties actually codify that in their orders and plans, and it's approved by the governor. We had discussions as recent as yesterday, and we're looking at making it a little bit more clear. So it'll be face coverings will be mandated throughout the state, right, in every county. So it's non-medical grade face coverings if you're in a public setting. And then I believe, don't quote me on this, but I believe we'll define that as if you're within anyone that's not from your household, if you'll be within 6 feet, you need to have the face covering on. And then any of the other exemptions, like under 5, and all of those details will be set forth in the county orders.
So I think there are a lot of folks who just feel like this should be something that's done right away. Can you tell us a little bit about what the timeline for something like that would be? The lieutenant governor was on here a while back, and he said that he thinks it should just be like a ticket, like jaywalking, where you're not wearing a mask. Okay, it's $100. There you go, as opposed to the misdemeanor that it is now, and having to perhaps go to court, because we're seeing, a lot of these cases actually get dismissed. We had HPD on here. They said that they'd issued 60,000 citations, and the vast majority of those have been dismissed. So it doesn't seem like a particularly effective way to enforce this order.
You do that. That's exactly correct. So we are working with the state legislature, and the Attorney General will put in a new legislative proposal. So what's unfortunate is that the way the law is written in 127 Alpha, Hawaii Revised Statutes 127 Alpha, is that we cannot do a ticket and a fine for the violations. So it would require law change for us to be able to go to a ticket and fine type of construct for violations of face covering. And as you mentioned, currently, if you're walking down the street and you get cited, it becomes a misdemeanor. It goes on your record. So even if it's thrown out, I believe it still be shown on your record. So what we want to do is work with the legislature to see if they'll be willing to come in to do a special session to get that legislative proposal passed, so that we can implement the ticket fine concept.
I want to kind of shift gears a little bit and talk specifically about some areas and the island of Lanai and currently what they are going through. Have you heard any update about what's happening there, and what are some of the efforts that maybe the state is doing to help? Obviously, a smaller community, there are some concerns of just overall capacity. Should some of these residents there need further attention and medical attention, and obviously the capacity of Lanai Hospital will not allow for a large surge. What is sort of the state doing to sort of prepare for any other possible surges there that could help those residents?
Right. So the state is in support of the county. What the county did is do the stay-at-home order to try to reduce the mobility, and then isolate those that are infected and then quarantine close contacts, right? The same thing we do to try to contain the disease anywhere else. We also are doing outreach and education, trying to explain to them, what the risks are. What we found is this huge cluster was a result of large social gatherings. So again, informing them that if you don't maintain that distance and wash your hands often and wear a face covering, even if it's your friend or your family member, you can get infected. Sometimes people let their guard down and thinking, hey, because it's a family member, I cannot get infected. And for Lanai, it's proven true that social gatherings and then someone gets infected and then they transmit it to someone within the household.
On that issue, we have the holidays coming up. We've got a holiday this weekend, and there's been a lot of consistent messaging, don't gather for Halloween. That may be followed, but that'll be probably a lot harder to enforce when it comes to something like Thanksgiving or Christmas. What are the state's plans in terms of how to encourage people to practice, traditions in a safe way? And what kind of a holiday season are you advocating for?
So I'm advocating for being within what the county orders are, right? So, no gatherings. If it's someone from outside of your household, no gatherings greater than 5. Try to do things virtually. And then again, I go back to mobility, right? The more you get out and about and do things that puts yourself and your family members and your friends at risk, the greater risk it is for the entire community. So for me personally, I'm going to be a Halloween Scrooge, unfortunately, and my lights are off, and I'm not going to be passing out candy this year. I just don't want to accept the risk for myself, and then my family, and then more importantly, I have a lot of close contact with the governor. Although I always wear my face covering when I'm with them, try my best to stay within 6 feet. Always do, most of the time. Sometimes you might by mistake, right, get a little bit closer, but just thinking that I am sick or the governor is sick and we just want to take care of each other. I keep telling this message. I love that, John DeFries, who recently took over the Hawaii Tourism Authority, HTA, his message is, hey, you malama me, I'll malama you. So you wear your face covering, I wear my face covering. We maintain this 6 feet of distance between each other, and we're taking care of each other. And I love that message. I always use it.
We want to bring another question here for Sherry Lynn, who's asking, why aren't military hospitals counted as testing sites for military members who are traveling? And maybe broader than just this specific question, but what is the state doing to maybe expand upon the number of trusted testing partners that are out there? I know you mentioned some locally, but just also on a broader scale for those on the mainland and military families such as this.
So we are constantly trying to increase the amount of trusted partners. The reason we went to that is going back to the artificial intelligence being able to read the results. Because what we don't want is, there's thousands and thousands, right, of labs out there, and we get all these different formatted test results that the AI cannot read, and then now we have thousands, maybe let's say 5,000 travelers that now a human would have to physically go in there. So when we first launched this, we were taking about 3 days to clear someone that already got their negative test results, and if it's the AI, that would be instantaneous. Going back to the first question, it's really, I don't control the military testing, and the way we've been adding on test partners is either the lab or the partner would come and contact us, and then the attorney generals and the Department of Health would screen it, and then we verify it with ETS that the AI can read their thing, and then we onboard. But I was never contacted by the military.
We're getting some questions here basically about giving tourists the accurate information. And so I wonder if you can address how we're getting the message to visitors about what our rules are. One thing that the Lieutenant Governor pointed out is that most of the folks you see here, if they are visitors, have gone through a test. And so they at least have had some COVID negativity versus the general population, which probably hasn't had that testing. Nevertheless, there are people who are complaining about seeing visitors, walking around around Waikiki without a mask on. Has there been enough education, and what are we doing to make sure that they're clear on who the trusted partners are and what the rules are once they get here?
So our communications team are working really, really hard to get the message out. There's several videos now that will be played at airports, on the flight, and also public service announcements. We just reviewed them last night, two really good videos I saw last night, one longer version and one short version. We're messaging on our websites, we're getting out there, and we're hoping by word of mouth too, right? That the word, it tells everyone, again, going back to what are the safe practices, right? Wear your face covering, social distance or physical distancing, and then wash your hands often.
You know, our time here is wrapping up, and we certainly thank you for taking the time to join us here and speak in length that you have. Is there any final thoughts that you have, messaging for our viewers and those watching as we sort of head into the holiday season, and anything else on things that you folks are working on moving forward?
I think the biggest message I have is a reminder that what I mentioned, right, the social gatherings is the number one cause of the large clusters from when we started this to now. And the malama, I malama you, you malama me concept, wear your facial covering, maintain that physical distancing, and washing your hands, that is what will prevent the disease from spreading, not the testing. Testing will help us to identify who's positive and who the close contacts are, but it won't prevent the disease from spreading. So just those safe practices. And if you don't need to have these huge parties, or if you don't need to go out trick-or-treating, let's think of something innovative that you can, your family, friends, smaller groups can have fun during the holiday season.
Okay, Major General Ken Hara, thank you so much for joining us this morning. We do appreciate your time.
Thank you.
Well, Ryan, very interesting to hear. There was a couple of things in there that were really that are important news updates, and one is the capacity for testing. The idea that we could triple our testing capacity to go from around 5,000 to 15,000 in short order would be very big for the state. Of course, as he just said there at the end, testing doesn't necessarily prevent infection, but it does show us where the infections are, and with those added contact tracers that he talked about, it helps to contain the virus.
Yeah, and really looking at a future where we could potentially be having people take these tests at the airports as they become more available. And it's almost, as he said, sort of buying time right now just to kind of make sure that the technology can catch up and that we are able to get this testing online. Of course, we had one of those possible testings, the Oceanet partners, that they were on this program a few weeks back talking about their advancements in that rapid testing, which hopefully will get FDA approval and begin that process to help to speed up and make more tests available. He also mentioned the upgrade for the contact tracing. Of course, that has been a point, really a point of concern by many, including the Lieutenant Governor at one point, about the lack of contact tracers. He's saying now that there are could be upwards of at least 1,200 people that are being able to kind of facilitate this. And so that is a big number and a big increase in that capacity as well.
Yeah, so they're working obviously hard to get the message out to visitors about what the rules are. And then he also talked about this idea of changing the statute so that instead of having a misdemeanor offense for not wearing your mask or not socially distancing or gathering, what have you, that you would get a simple fine. And that's something that the Lieutenant Governor has called for, just a statewide mask mandate. Don't do it, fine $100 or what have you, a simple fine as opposed to what we have right now. One of the issues with that I didn't realize is that you'd actually have to convene the legislature to pass legislation like that. He says the Attorney General is looking at it, but legally they'd have to convene the legislature. That's not happening anytime soon. So they'd actually have to do a special session if they want to get that done quickly. He did say it's something that they're talking about. It's something that we could see, but absent that, we could be waiting many months for something like that to happen.
Yeah, I mean, it is a process to kind of get the legislature back into session. It will cost money, of course, to kind of bring everybody together, even if it is just for one particular vote and for one particular issue. We've seen it done in the past, but really, again, the caveat is just time. And obviously, the state does not want to wait to gavel in on January 20th and wait to the end of the session in May for this law to be implemented. They want probably something done sooner. So we could see a special session coming in just for this ruling, which the governor does not have the authority to sort of make an executive order that would mandate this and would require legislative approval. So we'll stay posted and keep our eyes peeled to that to see if that is something that pans out. And someone we can actually talk to about this is the governor, who will be on our program next week.
That's right. He'll be joining us on Monday. We're going to ask him about that. We'll also be talking, of course, about Halloween weekend, how things went, and what that will mean when we look forward to the upcoming holiday. You know, I've started to think about what holiday plans are going to look like, and it will be very different this year. How does family gather, and what are they suggesting? Can you really do a Thanksgiving dinner over Zoom? I guess we're going to see. But when it comes to this weekend, of course, they are really encouraging the crowds not to gather in Waikiki and, you know, take a picture and upload it as opposed to go out and showing off your costume that way.
That's right. So we'll be talking to the governor, of course, next week is the election. And again, we want to thank our sponsors here at the Office of Election for bringing us this conversation. Election is on Tuesday. We encourage you to stay connected to the Honolulu Star-Advertisers for all the updates and results for the election that will be coming up. We anticipate that we will also be talking to some of the newly elected officials as they sort of come into play here, and we will be interviewing them throughout the month of November. We encourage all of you to continue to stay tuned for that listing of our guests, and encourage, if you have anyone that you would like us to interview, please enter that in the comments. We always love hearing your suggestions, and we'll try our best to get you connected with those individuals as well.
Yeah, so until we see you on Monday, have a very safe weekend. Take care of yourself and each other. As he said, I malama you, you malama me. Take care and have a great weekend. Aloha.
Aloha.
For this year's general election, registered voters need to watch for their ballots arriving by mail in mid-October. Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at locations statewide. There are no polling places, so be sure to drop off your ballot at a place of deposit.
Hawaii votes by mail.